Flaviviruses, simplified. Enveloped, single-stranded, positive-sense RNA, linear, replicate in the cytoplasm. Arboviruses, most are transmitted by arthropods, mosquitoes, except HCV, bloodborne. Major flaviviruses to know. 1. Hepatitis C virus, HCV, chronic hepatitis, transmitted via blood, IV drug use, sexual contact. 2. Yellow fever virus, jaundice, fever, black vomit, found in tropical Africa and South America. Councilman bodies, eosinophilic apoptotic liver cells. 3. Dengue virus, breakbone fever, severe muscle joint pain, may cause hemorrhagic fever, shock, spread by Aedes mosquito. 4. West Nile virus, meningoencephalitis, acute asymmetric flaccid paralysis, polio-like syndrome, transmitted by mosquitoes, reservoir, birds. 5. Zika virus, causes congenital microcephaly and brain defects, also fever, rash, conjunctivitis, transmitted via mosquitoes, sexual contact, vertical transmission. Yashat USMLE style questions. Question 1. A 25-year-old woman returns from a trip to Brazil. She reports mild fever, conjunctivitis, and a rash. She is currently 8 weeks pregnant. Her ultrasound shows fetal microcephaly. Which virus is the most likely cause of this presentation? A. Cytomegalovirus, B. Zika virus, C. Rubella virus, D. Dengue virus, E. Herpes simplex virus 2. Correct answer, B. Zika virus. Explanation: Zika virus, a flavivirus, is known for congenital infections causing microcephaly and brain defects. Transmitted by mosquitoes, but also sexually and vertically. Why not the others? A. CMV can cause congenital defects, but more commonly sensorineural hearing loss and paraventricular calcifications. C. Rubella. Congenital rubella causes cataracts, PDA, deafness, but not usually microcephaly alone. D. Dengue causes fever, joint pain, hemorrhagic symptoms, but not microcephaly. E. HSV2 can cause neonatal herpes, but usually leads to encephalitis, not microcephaly. Question 2. A 70-year-old man presents in summer with fever, headache, confusion, and flaccid paralysis of one leg. He lives in Louisiana near a wooded area. A lumbar puncture shows lymphocytic pleocytosis. Which virus is most likely responsible? A. Rabies virus, B. West Nile virus, C. HSV1, D. poliovirus, E. Varicella zoster virus. Correct answer, B. West Nile virus. Explanation: West Nile virus is a flavivirus that causes meningoencephalitis and asymmetric flaccid paralysis, especially in elderly patients. Transmitted via mosquitoes. Why not the others? A. Rabies causes encephalitis with hydrophobia and aerophobia. C. HSV1 causes encephalitis with temporal lobe involvement. D. Poliovirus can cause paralysis but now very rare in the U.S. E. VZV can cause shingles and encephalitis, but more often presents with painful dermatomal rash.